All right, well, good afternoon, everyone. Bienvenidos y buenas tardes, colegas y amigos.
Gracias.
Es un honor para mí presentarles a la moderadora del taller, mi amiga, a la doctora Edna Acosta. Es experta en participación comunitaria y líder del programa de investigación clínica y translacional de Puerto Rico. También le encanta el buen café puertorriqueño. So welcome and good afternoon, everyone, colleagues and friends. I do realize, of course, that by speaking Spanish, I will not be probably invited to any Spanish speakers home again. Second, probably not to the halftime of the Super Bowl, but that's okay. As long as our good friend Bad Bunny's there, that's quite all right.
So your moves, you know.
Yes, exactly. Very important. No one wants to see that. Dr. Wender can sing. I definitely cannot do anything else. Welcome to the workshop on measuring the impact of community engagement in research. I'm honored to introduce the workshop chairperson, my friend and colleague, Dr. Edna Acosta. She is an expert in community engagement and is a leader in the Puerto Rico Clinical and Translational Research Program, where she directs the Community Engagement and Outreach Core. Along with her colleague, Dr. Marzeda Sanchez, they actually founded the CEO core of the Puerto Rico CTR. I should give a shout out to our colleague, Dr. Sanchez as well, who is the director of Grupo Nexus, which has also contributed a great deal to our understanding of community engagement in Puerto Rico. For those of you who don't know, by the way, Puerto Rico had the highest vaccination rate of COVID-19 in the entire country, which is a fascinating statistic considering we have had trouble reaching underserved Latino communities in the mainland United States. But I think it demonstrates that it's about community engagement, not just about, say, race or ethnicity. Dr. Acosta Pérez received her PhD in psychology and did her postdoc in clinical research at the University of Puerto Rico in San Juan. She holds a CBPR, Community-Based Participatory Research certification from the University of New Mexico and collaborates with numerous academic and community organizations. Her work focuses on CENR and research in areas such as health promotion, mental health, sexuality, violence, and maternal and child health. As I already said, for those of you who didn't get my bad Spanish, she also loves great Puerto Rican coffee. We share that in common, and we always have great conversations around community engagement on all the wonderful things that make our population healthy and keep them healthy. So would you please join me in welcoming Dr. Edna?
A little bit, my microphone, that was great. I get scared with microphones, that's good. So, good afternoon. Keep enjoying your lunch. It was very good, thank you. And thank you for this opportunity. A little bit about me that you might not say. Well, I'm proud Caribbean woman. I was born in Ponce, Puerto Rico, which is at the south of the island. Oh, another Ponceña, there you go. So you see, Ponce is a city that blends warmth of its people and adapt cultural academic tradition. So as you know, you're very proud of their work, so I'm very proud also of my island. I'm the oldest child in my family. And I'm a mother of two energetic adolescent boys. I miss them, but I'm happy to be here 24 hours without them. I told them that this morning. I was very happy. So I need to be a little bit away from the hormone cows. You know, I have hormonal cows myself, so we are family of four with a lot of hormone changes. So it's a struggle, but we're always, up and down. So being a mother and a professional has taught me a lot about patience, empathy, and perseverance. Those are qualities that I also bring to my community work every day, and they are very meaningful. I'm also a first-generation college graduate, something that have shaped how I view access to education and access around everything around me. So my journey as an academic began in the University of Puerto Rico and completed there, even though I was able to travel to the University of New York and to Chicago, Illinois for summer internship and opportunities. So over the years, I had the privilege of working with and learning with multiple research initiatives within the university, within the same Puerto Rico and outside as well. And I have been involved for the couple of years with the Alliance, which is the Puerto Rico Alliance for Clinical and Translational Research, that has brought me here. So this presentation is partially supported by the Alliance, which has it has an Institutional Development Award, the second round already. The National Institute of General Medicine and Science, just at the 6th year here from Delaware. So I am very happy to be here and honored. So a little bit about what are we going to be doing today. We're going to try to explore the strategies of measuring the impact of community engagement in research. We'll try to move you around measurement, why measurement matters, and what to track, and how to track it, and how to integrate those metrics. We'll ground one of the samples in Puerto Rico, which is where I work at. The CTR we have in Puerto Rico is a long-standing relationship between three schools of medicines and other collaborators as well. As many of you are aware, community engagement is often described as that bridge that connects academic science with the realities of our communities. But as many of us already know, it's not enough to simply engage. We must be able to also show how our efforts are making a difference. And also, we'll be hearing that this morning. So in this session, I plan to cover 4 things. First, why measurement matters. Second, what outcomes we should be measuring, and the tools and the strategies that are available that we can use. I'll try to bring 3 or 4 case studies from Puerto Rico. My goal is that by the end of this workshop, you will have a couple of practical strategies that you can adopt. You will also have opportunity to share what you have been doing for mentoring community engagement as well. The work that we do is a collective effort. So here are the faces of marvelous women that have been the pillars of this DEO team. We have representation from the Ponce Health Science University, the Universidad Central del Caribe, and the University of Puerto Rico Medical Science Campus. But like all community engagement efforts, we are, our work lays across the doors of our university. So we have many collaborators from the multi-sectorial arena. So here's just a show of several of those logos with representation of over 21 members of the Community Health and Research Council, which I will tell you a little bit more with our first case study. So these represent community organizations, NGOs, health providers, and academia, and we have 2 individual citizens. And I will tell you a little bit more about how these people have been contributing to what we have been doing. So let's start with a simple question: why measure community engagement? So first, these are the 4 reasons there may be more than those. So these are the 4 reasons that I believe are more important here. So first, measurement builds accountability and transparency. We know that communities need to know that their voices matter and that their contributions are shaping the research agenda. So, but also sponsors, whoever is funding the research and our institutions also require that evidence is there, that engagement is real, is systematic, and is impactful. Second, measurement allows for continual improvement, quality of care, continued improvement. So we want to do that without data as well. Without data, it's difficult to identify those gaps. It's difficult to demonstrate growth, especially in the areas of trust and partnership capacity, which are the basics of community engagement. And thirdly, measurement increases the visibility of community engagement. And I have been hearing that today across the several questions. How can we make more visible what we have been doing? Meaning, how can they give us more funds to keep doing the work we're doing, right?
Right.
We don't want them to see us, we want them to fund what we're doing. So too often engagement is seen as something soft and intangible because it takes a lot of time to make it happen. So a task that requires much responsibility and make sure that the input and impact is visible is I think it's a responsibility that most of us carry around. We just have to implement it differently. Researchers have a way to disseminate, communities have a way to disseminate, but together we need to make sure that's exponentially gets better. And lastly, by systematically measuring community engagement outcomes, we can show that it's essential, what is essential for translational research, right? The sustainability of partnerships. So we want this to to have a long history. So in sum, measurement is essential for community, participation matters for funders. It makes the engagement visible for partnership because it helps sustain the improvement. So, well, I think that if all our agendas are covered, we all win. We want to try to make that possible. So hoping that we all convinced, I know you are, about the importance of measuring. So now I want to talk a little bit about once we recognize the importance of measurement, the question is what should we measure, especially when we don't have too many resources to measure, too much time to do it, and we have people doing more than one role in one particular activity. So measurement can be viewed as layers. This is not my I don't want to give a class about evaluation and measurement, but we need to make sure that we see evaluation and measurement in layers like a ladder, right? So at the base, we have the process and the structural measures. These are the things that, how often we meet, how many people are participating in the activities we do in the council meetings, in the community forum, what kind of representation is getting there, how much involvement is people getting, so how many trainings, how many consultations we did. Those are number, tally. And those tell a story. There's, those are the basic. It's important, but those are the basic. So that process measures the assistance of the community engagement. And sometimes its characteristics, how is that engagement, how that engagement is. For this measure answer, if we are doing engagement consistently, is this measurement making sure that all the people that need to be there is there, that all those voices are being elevated and are being present. So even at this process level, that is the basic one, you can inform things that are very important. Are all those voices, all those levels included? The next level is the relational or proximal outcomes. These include, I will say, more deeper and important values for me, like trust. How is the trust in that collaboration? Are the roles clear enough for people to know what they need to do? Are those perceptions of influence clear enough so they know how they can help support the research they have to do? These are critical because they capture the quality of collaboration. So it's not only if there's a collaboration, but how good is that collaboration? How fair is that collaboration? That partnership, how healthy it is. Beyond that, obviously, we look at the intermediate or long-term outcomes. So things like how many community academic partnerships we have been able to promote and sustain, how many pilot projects we have been able to sponsor or being part of, and how many mentors, mentee relationships, stuff like that are more NIH kind of the products they want. But you cannot get this without the previous ones. So these kind of measure the intermediate outcomes answer if we are seeing growth in capacity, if we are seeing growth in innovation, if we are seeing growth in co-creating research. And finally, we reach the long-term outcomes. These track, I will say, real-world changes. Those that are more difficult to achieve, like a policy change, like a program direction, like the was that Dr. Werner mentioned this morning, having in the budget that particular, what was the concept he said?
Operational.
Yes. How you make sure that in the operational budget, you have those participants from the community that will make sure you co-create, that make sure you build trust. So you have that, to have that. And I know the answer, but you wanted to make sure that it's there because those leaders are the ones who make a decision on the budgets, on the operational budget. So you want their voices to be there. So this measure answers if that engagement that began at the beginning is improving the life of people, but it's also improving the system, either by treating or changing or shaking them or creating new options of systems. Sometimes we don't see that possibility, but sometimes we need to create new ways of doing things. So how to measure? Now let's talk a little bit briefly about one approach we can use is governance and attendance data. That's the simple one. Simple table, meetings, of course. The other ones is the survey-based measurements. Those are usually the most used in the academia because already people develop questions, develop scales, they're already validated or they're in your language. So it's an effective way of documenting things like trust, like clarity, like satisfaction. More importantly, to classify trust. You can have a way of making sure what kind of trust spectrum is working. If you're working from the deficit trust or you're going more to a reflective kind of trust. But my encourage here is to mix methods. That will create a better picture about what we're doing and the impact. So tools of governance data are good, but also focus groups, interviews, maybe quick data collection, like after a section, write a couple of words about what you felt, how you feel, and be consistent with that. The triangulation of information, the triangulating approaches enriches findings. As you know, quantitative measurements are useful, but sometimes they don't transmit the heart of the people and the values. So I will suggest mixed methods. I'm going to skip this one just for later. And I want to talk to you about our first case, which is the Community Health and Research Council in Puerto Rico. I think I read the wrong there. So this is our first Health and Research Council of the Alliance. It began near 2019. We were trying to build it up before, but there was no chance. And this is a picture from our first retreat. It was the first community engagement retreat we performed. The reason for that retreat was threefold. We wanted to make sure to tell the story about how the community engagement was going through the university, but also gather information about what the renewal phase will look like. So what these participants from the all the sectors in Puerto Rico wanted to see us do in the next 5 years. But we challenged this council because we brought for this retreat new people they didn't know, new hospitals, new community-based organizations, and it was a very interesting a whole day retreat, and we ended up with a self-care activity. When you co-share things with community members, things happen the way they need to say. So we were building this nice academic retreat, to gather that feedback, to make sure we have the data. And then our co-chair from the community, we had two co-chairs from the community and one from the academic. He said, well, I think you need space to, get close to people, talk about your family. So he created this activity, which was self-care and to build up. So everyone had to paint, but each of those paintings had a color that exclusively represent one of those members there. So we all finished with one painting that had representation from the 36 participants that were there. we brought 60 colors. We were like, oh, good. So it was very, it was good. Just to share a cute story and but an important one. So the Alliance created this community council as part of the community engagement. It was our, I think, our first aim. So the council is just not symbolic. As you know, council and advisory board, sometimes it gets like, we get used to having too many boards and too many consultation and advisory. So it's very important that it's not considered just symbolic. So this council brings together these 25 members. They receive an incentive every time they work, because they are there providing their voices, their experience, so they're working. We meet around 6 times a year, minimum. If we need them, we call them a little bit more. Most of our meetings are virtually or hybrid, to make sure that everyone in Florida Island can come up and visit. And it has representation from this council meeting. They also collaborate. We have representative for the advisory board, for the STEM advisory board, and for one additional council that is called the Health Alliance Innovation Council. It is a new council, a higher top hierarchy kind of council where people come to say and decide how the funding goes within the alliance, who gets what and what topic we're going to be deciding. So we have representation there from a community council. So this governance model have demonstrated both that accountability and structural integration of community voices into research helps. And the other one here, okay. So in collaboration with the community council, and also, we also have a tracking and unit core like you. Over the past 4 years, we have been studied systematically, giving us, longitudinal data sets on trust, clarity, and outcomes in community academic partnerships. So between 2020 and 2024, we have an annual survey, and everybody has participated diligently because they knew we wanted to continue, data monitoring, making sure they feel comfortable, they feel that they are creating and improving science in the island. So between those years, an annual show up that from 67 to 91% of the participants were community partners. Most of them were Hispanic. So we ensured that the group represented what we had outside. So this provides longitudinal evidence rather than just a snapshot. And importantly, the council members classify trust along the spectrum. They say from the deficit trust all the way to the reflective trust. So it allows us to see that trust evolves over time, obviously, but overall engagement time, getting along with the activities. We use the tools Encuesta or Fuertes, which is the Nina Wallenstein's community adapted version of this questionnaire. It is a 46 close-ended questionnaire with 4 open-ended questions. It covers clarity, it covers role, trust, it covers community-based participatory research principles. So far, the results are going there. In summary, this case study about the community council, we can say that what we measured in the community, it has been impacting. At the process level, we see that members participate in the councils. They come to every meeting around 91%. And at the relational measure, when we administer the longitudinal scale, we were able to demonstrate that trust grew across 4 years from 36% at the beginning to 83% at the end. Most of our members stay participating, but every year we have 2 new members to the council. So like 2 of them go aside to they retire and then they continue. So every year we have new members. So far it takes a little bit of time to get this data, but it's important that you monitor every year. Otherwise, you will be meeting for many years without the data. One of the main activities of the community council was to make sure that we evaluated the health priorities in the island. So with them in our hands, these are the promotional flyers for community forums. These they happened between 2020, 2021, and 2022, depending of the situation that we were living in the island. So the council helped us to do these community forums to prioritize health needs in the research agenda within the alliance. So with that consultancy, these 8 forums engaged over 200 people, mostly women, from 55 of the 78 municipalities. Participants that came to the forum, they were either people with lived experience or they provide services to homeless, low-income communities, LGBT families, or families with diverse functional members, and immigrants as well. So results voice the needs around homelessness, trauma, and discrimination. What we did during these forums is that we provided like the epidemiological data about the situation, about trauma, about homelessness, and then we divided into groups and we validated with the community members if that data represented the situation that was happening. And then we had a discussion and prioritized what were the needs of the community at that moment. And all those, there were around, I will say 36 needs that the community forums identify, that the participants at the community forum identify, and from those, they prioritize 19. Of those 19, we shared them with the Alliance governance and with the council members, and they validated that priority. And then after that, the rest of the years were involved into updating and doing work to making sure those needs, change it. Hold on, because this is not moving. Okay. Okay, don't worry. So the Alliance leaders here, they ensure that at least 80% of the advisory board members and the governance of the Alliance validated those priorities. And through the last 2 years, 70% of those 19 needs have been addressed at some level, either by research projects that were promoted, by direct services that were needed, funding. Some of them needed more like publication or training. So whatever those needs were addressed, 70 of them. Most that were not addressed were because 100% of them needed policy change. So we haven't reached those yet. Even though we have, we have performed efforts to change the policy, it hasn't been approved. Out of this work, we met the ladder in the 3rd stage for the intermediate outcomes, where intentional collaborations were encouraged of those 19 needs. And for example, 14 community academic partnerships were promoted and sustained in topics such as homelessness, chronic disease, brutal aging, and water safety in these participants. The third study will be the Puerto Rico First Practice-Based Research Network. I know you already have one. We launched ours in 2022. And this network now, 2 years after, includes over 120 collaborators, including hospitals, university, nonprofits, and health qualifying FQHC. So over 20 collaborations already. MOUs have been signed. So it has structures the same, similar. It has an advisory group, it has a research protocol committee, and it has like an IDA club, which is more of a training kind of environment, where 80% of the members participate regularly. They meet monthly. And this is an infrastructure that has been helped because of the community engagement that was beforehand. So this, what we did is like enhance that community engagement to include the clinical piece that was missing and some of the private piece that is, coming in. So it has, like I mentioned, it has that structure. And I think I already mentioned that one. Well, at this moment, they have 5 pilot projects already running from the 2022 up to date. So this is one of the promotion of funding for pilot after the needs. Several of the needs were related to elderly, so we were able to encourage more research directed to the elderly during 2023, and these protocols are finishing this year already. So the Alliance Pilot Funding Program illustrates how engagement translates into tangible returns. At this moment, the Alliance invested a little bit less than 800,000 in pilot project during the last round, which was 4 years. And these projects later leveraged over 6 million in grants, yielding a return of investment, a very high one, as past year. This is as 2024. So at the same time, the number of principal investigators that are involved in community research grew by 30%. And the base of principal investigator also increased by 30%. Last week, we had the news that the School of Health Professions received their first R1 with Dr. Elsa Orellano this week. She's going to be working. She has a model, an application for elderly, other people that needs support to walk around and stuff like that. So it's more of a technical environment. And I remember when she began her first community academic partnership, she had little information about how to do research. And I remember that first meeting, she said, like, I want to do research, but I just don't know how. And so we sat, she received the training, she enrolled in the mentor-mentee. Obviously, she did a dissertation, she has a PhD, but it wasn't the topic she was interested in. So then she moved closer and she began her first community academic partnership by getting to community, an elderly community, and asking them what they needed most. And what they needed most, it was technical assistance. So she built her research career after that, after that consultation. So I will say almost 10 years after she has her R01. But this was a person that she graduated, and I don't know, she got to know with a community engagement activity. She said, I think I want to do research. So, and we had that opportunity there. So it's a great opportunity. So anyway, I got excited. Yeah, so while measuring community engagement is essential, it comes with several recurring challenges, as you know, that may face. One of them can be measuring activities and no outcomes. Sometimes that happens. It's easy to report how many meetings we have held, how many trainings we have offered, and how many participants attended. However, these numbers allow not to tell us whether trust was built. It doesn't let us know if knowledge was exchanged. It doesn't let us know what is the capacity of the community that was increased. The second one, and I know maybe some of you have experienced that. Many projects collect data from community participants and are analyzed, but they forget to report back, and they report like to close the loop. If you begin the loop of getting information of what is needed to do, you need to close the loop with those participants as well. So that loop continues to create. So this breaks trust, and this manages the transparency in Puerto Rico. But sometimes, we have been encouraging that a long time, but it's a struggle. I think it's one of our main challenges, especially with the young ones, because the pressure of publishing in the journal is high and they need to continue. So we need to identify strategies that allow us to develop the post to develop the newsletter, to also write in the press, to make sure we are in the social media, to make sure that we also publish, in the journals. But we are able to do it. Today, I don't have time to show you, but we have developed infographics. We have a Facebook page. We have many things that one of my colleagues say, well, that's a lot of noise and I don't have time for that. I need to publish that one. I said, well, you don't need to do it all. This is a team of work. So we have a communication unit that will help you communicate your science in other venues that is not the publication that you want to do in the journal, because we want to make sure that everyone gets that information. And then it gets validated with the community. So our community council evaluates those posts and they make sure that they have the correct language. And the fourth one, I will say that sometimes community partners are invited to participate symbolically. So you need to make sure that doesn't happen. The decisions are made not only between academic teams. This undermines the genuinity of the co-leadership. So we intentionally counter this by assigning co-chairs positions to activities, to assign co-chair positions to other councils, to make sure we have representation in the other governance. This took a lot of time to happen. I think in the third round of funding, it was made possible, which was the last one. So now one is already like, there's no question about it. We just confirm that this is possible. So these pitfalls are common. Puerto Rico experience just show that they can be transformed into opportunities by building the infrastructure, like promoting, more training, more inclusion within the members, and investing, obviously. So I wanted to do with you an exercise before time's finished. I think we still have some time. I want you to tell us, or to tell me, how do you do it? What do you measure, and what do you how do you measure it, and how do you share that data around? So these are a couple of ideas. So maybe I don't know if you're ready. So let's imagine together and plan. Pick a community engagement that you already have into plan. Maybe in this month that you have an activity, and how are you planning to evaluate that? Are you deciding for a process evaluation? Do you have a relational evaluation? A translational outcome to document? Any of you have any activity soon to be that you can walk with me how you plan to do it, or how you might do it? You don't have to, commit to it. But going through the process of mapping it will be great. So you can see an opportunity or something that's happened. Come on. You must have something in October that's going on that is not a birthday.
So I'll share, not necessarily like one particular event or activity, but one of the things that we typically try to do is in our partnerships, as we're engaging with communities, is constantly have that open door of communication when we're looking at programmatic efforts that we're working with these organizations on. And part of that is understanding where they are, how they're implementing the programs, what else is needed from our end, from a healthcare institution, to help support maybe their capacity or infrastructure. And so there's always this two-way dialogue. What we ask of them by the end of the year is the numbers piece, right? Okay. But then also, did you notice if there was behavior change, right? And so in some instances, we're able to get really good information on that, and others not as much. But we also try to report our information through an infographic that Elena here does a phenomenal job. She does an infographic, like very state specific, but then it also in our region. And then the other thing that we also do is we have newsletters that come out periodically, and we'll highlight a partner and share information. So a couple of years ago, also, one of the things that we started to do around community engagement is we recognized that healthcare institutions are used to being insular, right? Inside, in the patient setting, clinic, hospital, OR in the surgical rooms. And they don't necessarily, even though they can understand some of the social determinants that are impacting health that they're seeing in these clinical spaces, they don't necessarily fully understand communities and what's happening in communities. And so one of the things that we started to do a couple of years ago very intentionally was social media posts, telling the story of what we're doing in the community, showing pictures, highlighting partners, highlighting events, highlighting activities. And so what we've learned from that is that enabled us to get a whole lot more credit and understanding of what it means for our organization and what it looks like in our local communities. And so many folks that I know here know that we do post all of the time, but it's because if we don't tell the story of what's happening, nobody's going to tell the story, or they're going to tell a story that probably doesn't really reflect the work that we're doing. So I think from a data perspective, we use all of those touch points to try to get information. I think for us, measuring knowledge and capacity is something I think we could do a little bit better on. I think the trust piece, we've never really measured it, but that's one thing I think we could probably add into our indicators, because we've built these robust partnerships over time, which translates, at least to me, that there's trust there, right?
Exactly.
If there's
They continue coming.
Right, exactly. So I think, those are things that I think we can do a little bit better, but we're always trying to find new ways to identify, share, and capture the data and figure out all these different platforms that we have available of sharing that information. And our budget is built into our operating budget. So it's not like we have to pay for grants. So that in itself creates sustainability. But my job and my team's job is to make sure we tell the story so that they can see that there's value add in this work that we're doing in the community.
So how, thank you for sharing. How your partners can tell you a little bit more about behavioral change or knowledge? Maybe a quick, open question, a postcard at the end of the day, something new you learned or something you shared.
Yes, and I
That's
think,
something very easy.
yep, and I think we can add that into our template.
Some of them do it for us, like they'll have like testimonials from, participants in their programs. And so, yeah, it depends on the partner, because some of them, like I'll use an example, like we work with local food banks and they do like some summer feeding backpack programs. So it's not something that they're actually teaching someone, like, so how do you get like the knowledge piece, like from that perspective,
Maybe we can add it into our template and add some key questions for them to answer.
Because to evaluate knowledge, you will have to, do either pre or post.
But yeah, so
Quick 3-5 questions before and the same after, or if it's the same people, you can evaluate at the beginning of the training and at the end of the year. But if you have different people, you will have to, make for every day. It could be just a post. You can assume also, what people know about this topic and then assume they will be better. Yes?
It's, I think related to that, and I used to oversee the funding for a bunch of United Way organizations.
Yeah.
And collectively, we came up with a set of outcomes, and which could be slightly modified. So we wanted them to measure the outcomes. Now, how they measured them was up to them.
Yes.
So that's their part. But our first line of what to measure, we determined collectively. And then the movement of their outcome for their organization.
Yeah.
Have they articulated those measures? Are they actually measure them? And can they give information back?
Exactly, but you cannot assume they know how to do it. So we want to measure this, which is the aim, right? Usually it's tied to the funding and to whatever you want to achieve. But then how to measure, you can give them options. You can do a focus group at the end of the year. You can do individuals 15 minutes interview with people at the end of the session. You could do a survey, but you need to give them options, easy. And also that what you mentioned collectively is a very good opportunity. If you have your partners, try to decide on the same measure. Everyone uses the same measure, the same variable, the same type of question. And at the end of the year, you all go together and have a better impact because you have a better sample size for the same question, the same activity. Some of us have typical services and activities that we do the same across the, everywhere. We do training in ethics. Let's try to use the same survey to evaluate trust. There's good measures for evaluating trust. Let's try to use the same one, because then we can share databases and make a better evaluation along time.
It's kind of interesting too, because we'll have dozens of models that can relate to this,
Yes.
but, a lot of times we also use the collective impact model.
Yes, that's
And you could easily align that with some of the stuff for community engagement.
Yeah.
Yeah. Do you have a common agenda? Do you have a common measurement system? Those kinds of things. So, yeah.
Well, the basic of collective impact theory is community engagement. There's
Yeah.
trust, and there's a common agenda that we are building on, and there's decision making about how we're going to evaluate, but without any of us getting invisible in the process of doing collaborative, engagement. So everyone can highlight. That was good. Any other sample? Please. Okay, so one training, finding the process and the relational outcomes are usually more easy. You can have, like we mentioned, number of community academic partnership, number of projects and grants and protocols developed, activities and stuff. But the relationship, the translational impact is one of the challenges, the most challenging one. So there, you need to make maybe, sit down and make decision in group of what variables, what you want to measure a long time, because it's an investment for long-term, sustainability. Okay, so, and if you want to make some changes, well, the last one is how to make sure we share it. I think the post is very good, and one of the things we try to do is get collaboration with other partners so we can post each other, and there's a lot of language in that arena, which is not mine. But social media, there's a lot of that you can reach by collaborating with other sites in posting or reposting or sharing your posts, and that will increase a lot of your outcome. So to close, I don't want to keep you more. I want to highlight the 4 takeaways. First, define success together with your communities. That's very important, not just within your institution. So start the loop with the community present. So it will be easier to close the loop with them present at the end. Second, measure not only the output, but also the quality of the relationship. Don't forget that. Maybe our NIH is not that interested in this moment of those relationships, but they will help you justify better decisions later. The stronger relationship stays. It stays through the crisis, through everything, through non-funding. So it will be one of the investments for sustainability relationships. So you make sure you cultivate them. Third, align your metrics with the translational benefits so you can show engagement and how that engagement is contributing to the health of your community, to the change of the systemic change. You can maybe draw a line along the time. And finally, close the loop. You started the loop with your community, close the loop, bring the results back to the community so they can see the value of their impact and their participation. So they will say, well, it makes sense to continue participating because the services that we are receiving are mirroring what we need. It makes sense because we are helping, we're also contributing, and you can tie that along the way. So not only closing the loop will help empower also community as a contributor, as a communicator for your partner as well. And thank you all for your attention. I will happy you have any other questions for me. I don't know what happened here. Yeah.
So I didn't even think of this until like the last couple minutes, but so I want to use the group as a
Yes.
sounding board and ask your advice. I'm with the library system, social workers and all that's good stuff. And I was asked by Newcastle County to give our data without a unique, there's no identifiers, all right, of all the different things we collect for the social service and the jobs and all that. So it's a lot of detail. And there would be infographics and all like that. And they want to put it in their annual report that the whole public can see. So there's a huge, it's a question of, do we do that much, or do we do like one little tiny infographic? What are your thoughts? Because that could really be impactful to, it really can be very helpful for people, but it could also inflame people. I don't know. What do you think?
You have to ask them.
Yeah.
I would say you have to ask
Exactly.
them. At the
Yeah.
beginning of the process of the council, one of the discussions is what to share, what not to share. So they need to decide, yes, we don't mind about the picture, or yes, we don't mind, and do this and use this information. So you need to ask them.
I need to ask yeah, okay. All right. And then did you have something to say?
I was just gonna ask also, did you say that they want to know what services you're providing or what services are needed?
No, they want to know, we provide all these services. Now they
Okay.
want to see the people are coming in, what are they asking for? How many people are coming in for this. And I've got a lot of data. So I can say numbers, how many people we did this year, how many for this. I mean, I get lots and lots of data, which is very valuable for all of us, honestly. And I can do it for the whole state, but this is for Newcastle County. So, and in fact, I actually like the fact that makes me feel better that it's only one county, because I don't want to show I don't want to show the comparisons on this particular thing. So I don't know, but
Why are you afraid of showing or not showing? Because I don't. What do you see as a potential negative outcome of informing all that information?
if we divide it out by libraries for only one county, it's going to look strange while some libraries are much busier than others, and it doesn't necessarily make
Exactly.
sense. It really would not make sense if you looked at it statewide, because there's one library in the state that's like crazy busy compared to everybody else. So I'm glad that's not in the factor. So it happens not to be in Newcastle County. But anyway, I don't know. I don't know.
Will make sense without telling where? Maybe.
I could do that. I could do that. I could
maybe
just say
the
in Newcastle
services
County.
don't
Access. And then you think, do you think it's, I guess what I'm asking, I know a lot of people here
I
are
know
from
what
Newcastle
you
County. Do you feel that's safe? People just like saying all the different things?
So I think it's also, who's your audience? I mean, you could have,
Well, it's gonna be.
that's something, you could have a half a dozen different infographics, you know, like, if I do something, I do a different report to funders than I would to participants in the program, than I would to other stakeholders.
Supposedly, this is something that is for the board, but then it goes to the public, and it's supposedly supposed to be out there for people to get at all. Who really reads it is probably not, let's face it, we know not everybody's reading this, so.
Yeah, because the people outside wants to know what service is allowed,
Right.
is available and where, and if it costs and how long it's open and
Right.
how available it is. The board doesn't
Then
want to know
that wouldn't even be in what we were doing. We were actually giving the data of what we did. All right, well, I'll work with this. But I
Maybe
think
you
that
have
you've helped me a
more
lot.
than one infographic, one for the public and one for the board.
Yeah.
Board.
I'll see if they could rewrite it to a different way.
Well,
That's a good idea.
Yeah, because the audience is very important. You don't need to show the same information because you have a different, your goal of what you want to communicate.
I 100% agree. I think that's.
Sometimes you need to decide how to protect people by not saying too much, so you need to make that decision. What
Right.
information is useful and what can be backfire, so you don't want that to be there.
Yeah, thank you. Thank you all. All right.
Take care. No, thank you. Any other questions?
I just want to do a really quick comment, because one of the things is that sometimes, you ask a lot of things that a community help to do the XO or works. But at the same time, it's important that you just use that people that you are asking for information, also use it in the discussion of the results. Because sometimes they use a community liaison to just look for information, but after that, when you are just discussing what is the results, you never take you never take their opinion in the discussion. And then I think that this is something that will help to just increase the trust, to just doing, I make my effort to give it to you the information, but I want to be here if when you are discussing, also my voice is
Exactly.
here. So
It's a validation point. Evaluate. You could use it as validation to show the community the results, their voices, and how they see that, how they help you interpret the data. Because you as an academic has a different way of seeing it. And you can have a discussion of how you see the same data and how they evaluate the same data. And that's a validation point, very important and very publishable. But in the other side, it provides the opportunity for the participant to say how my voice can be also used as an interpretation of the data itself beyond being a participant. Thank you very much.
Thank you.